first piece is all about the breathing, and it's learning to do a Pilates breath. It'll come in time. Doesn't normally, for most people, happen straight away, but I'm going to show you what we're aiming for. So the initial breath that I take everyone through, especially in clinic as well, is what we call diaphragmatic breathing, or yoga breathing, meditation breathing. It's learning to fill the lungs up and take a nice deep breath. So I'm going to turn slightly sideways so you can sort of see what I'm up to in there. And I'm going to place a hand on my lower abdomen and a hand on my chest. So what I don't want is this hand moving up and down as I breathe, like a stress breath. This is the one I want to come in and out as I flow. So the diaphragm sits here. As I take a breath in, I'm allowing the diaphragm, or I'm pulling the diaphragm down. I'm filling my lungs up with air, and my belly should get fat. Later on in the Pilates breath, we prevent that from happening because we take the breath into the lateral aspect, so we do lateral breathing. But for now, let's just do this. So hands on the chest, hands on the abdomen, and then your nose is a circular movement, so it comes in through the nose, filtering all the air, and then out through the mouth when you release. I make it noisy because later on, I might not make it noisy on the first bit, but later on you'll use that noise, that power to lock off the core, but you'll see that as we get there. So in a nice neutral spine, shoulders nice and open, chest open, take a breath in through the nose, belly sticking out, and then breathe out. Belly comes out, belly goes in. Okay, so that's your meditation, or Pilates, no, meditation breathing. To take that laterally, I use the hands as a bit of a compressor on the rib cage. So we are learning to involve the core, pull up and pull in through the core, and breathe in through the ribs, lower ribs. So we take a breath in through the nose, and we breathe out. This is where I'll get noisy. I'll come frontwards, so I think it helps you more in this position. So here, we're going to breathe in through the rib cage, and then holding that still center. Nice and tall through your body. Your air comes in, warms up into the chest, into the lower aspects of your rib cage. You should see your hands opening up via the rib cage, not you sliding around. So we hold the hands nice and steady on the side of the ribs. We take a breath in. That didn't work. And breathe out. And breathe in. And breathe out. The core still nice and firmly held. Okay, that's a seated one. It's not as easy in the seated position, but I thought it would be good for you to see. So here I've got for my head either a towel or a block, depending on what you would need. Hopefully my head won't actually need either of those. So we're going to slide our legs out to the side, take our feet out, have our knees at 90 degrees. I like to work with your feet flat on the floor, but still hip width apart. And then gently roll down, using your legs as support, squeezing the abdominal muscles, and we're coming to a nice, comfortable layer down position. Moving hair out the way, lengthen your spine, bring the feet so that they're nice and flat on the floor. The first thing we'll do is we will look at our neutral position for our pelvis. So we use the hands, we use the heel of the hands here and the fingers together, and we put them on the heel of the hands on the hip bones and the fingers on the pubic bone. In this position, you should feel like there's a spirit level, could go from hip to hip either way, so that you are in a nice straight position. That should give you a little gap in the lumbar area and a nice flat area. You could stand a glass of water on there, but if you tilt one way or the other, you lose the bowl of water. Okay, so from this position, we're going to take a nice breath in. So breathing in through and enlarging the belly, so belly breathing. And then blow out. And blow out. If you're having trouble with this, place the hands, one on the abdomen or over the belly button and one on your chest. Your chest should not rise. Okay, so that was the breathing that we did. If you were with me in clinic, that would be your belly breathing, 30 breaths per night. But that was also the breathing I did seated just now, if you haven't seen it before. Now we're going to take that breath by contracting what we call the powerhouse or the core, or what really does sort of strengthen up around our spine. So we're going to draw those muscles in, using the belly button pulled towards the spine, and then just using the bellows of the lungs. So we breathe into our hands now. So I push a little bit on my ribs before I breathe in, and then I breathe in through the nose. And then I breathe out. As I breathe out, really exhaling. Squeezing the abdominal so you're still nice and tight through the core, and these ribs are moving. And then still holding that neutral position. Now these breathing exercises on themselves are quite hard work, because we don't focus on our breathing all the time. We don't focus on opening up the lungs. We do a lot of upper respiratory breathing, which is why a lot of people are so rotated in the shoulders. So from there, I'm going to take you into imprinting, which means that we're safe. The back is on the floor. I do that via breathing. So we're going to put the hands back, heels of the hands on the hip bones, fingers on the pubic bone. Take a nice breath in. And as you breathe out, pull up and pull in through your center like zip up and hollow. Lengthening through the spine, lengthening the back of the head. The chin is on a level. Everything feels from the tailbone pulled towards your feet and the head pulled up towards the wall. Everything's lengthened. Okay, from there you can gently breathe in, and we're going back to neutral. And then we go again. Really squeeze, pubic high, hip bones down. Don't compress the spine into the mat, but feel how it elongates and stretches as we do that imprinting movement. And then breathe in and release. And you go back to your neutral position, where if you had a glass of water, it would be sitting quite happily. This is where we do a lot of our work from the imprinted position, so that we're nice and safe. If you have a very curved lumbar area, this is where a hand towel can come in beautifully. So you just lift up, put a hand towel just in there, and then when you go into, a little bit higher, when you go into imprinting, I'll just demonstrate it. Blow, squeeze, you'll find that you don't get so much strain if you are very hyperlordotic. I would have told you that if I've met you. If you think you've got a big bottom, you may be set in that way with your pelvis. And then as you release, you just take the pressure off and fall back to normal, and then blow again. But it's all about engaging those muscles. Okay, so I'm going to release the towel because I don't need that. My back isn't, either way actually, I'm quite lucky. It's in a good position. And then we're going to come up from the mat, and that's the first part of our breathing exercises. So you've got breathing and imprinted. So I'm going to take my knee and hold that, and then I'm going to lengthen that leg, lift my head and push with my knee to bring myself in an upright position. If that didn't work for you and you have got a bad back, please don't do that. Keep your legs bent, unroll onto your side so you're completely safe, and then gently walk the hands into the position.